Good afternoon, everyone. I am certainly not the end-all for all HIPAA things, but I can speak to some of the avenues of HIPAA and the challenges we face in our current unsteady era of the pandemic. I'm Erica Howdeshell. I'm actually the Telemedicine Coordinator here at Phelps Health. I've been the Telemedicine Coordinator since 2018, but I don't think we really knew how far we would go with telemedicine when the program was started. So with that, I'll go ahead and continue. Today, we're going to go over a policy review, some HIPAA requirements, platform considerations, environmental considerations, and then there'll be time for questions at the end. For a policy review, there are 3 policies that we would need to consider when we're talking about telehealth compliance. The first is the Health Insurance Portability and Accountability Act, or HIPAA. The other one that ties into that, the Health Information Technology for Economical Clinical Health, or the HITECH Act. And then, of course, our most recent, the Coronavirus Aid, Relief, and Economic Security Act, better known amongst public health as the COVID Public Health Emergency Waivers, which pretty much opened the door for telemedicine everywhere. The first up is HIPAA. The Health Insurance Portability and Accountability Act of 1996 was enacted August 21st, 1996, and protects personal health information. It does not contain a specific section on telehealth. There are telehealth provisions or use does not alter a covered entity's obligation under HIPAA, and the same rules apply. So there's a lot of gray areas and a lot of hoops to jump through to try to maintain that security when you're talking about the electronics and the different platforms that are utilized. HITECH, or the Health Information Technology for Economical Clinical Health, HITECH Act of 2009, was created or further clarified provisions that impacted HIPAA. Only certain parties called covered entities are subject to HIPAA. And that's really important when we get further into the waivers. You'll understand how this can really be a gray area during this time. Entities that include covered entities are your health plans, healthcare providers, healthcare clearinghouses, and business associates. The next one is the CARES Act, or COVID-19 waivers. They were initiated in March of 2020. The current expiration date is August 31st, 2021. It expanded platforms and locations for how telemedicine can be given. So when the CARES Act was initiated, rural health clinics such as Phelps Health and federally qualified health centers were unable to do telemedicine. CMS would not pay for telemedicine into a patient's home, which opens up a whole nother avenue of trying to maintain HIPAA. They had to be at a location in order to deliver the care. So the CARES Act really opened some of the guidelines for everyone and reduced some of the paperwork. And with that, you must prove a good faith effort to maintain privacy. So while they're not really hounding HIPAA, you won't be scrutinized for privacy issues as long as you can prove a good faith effort to maintain that privacy. So that is really important. And then verbal consent is approved. So you should be getting verbal consent from your patients to do the visit via telemedicine. And with that consent, you should discuss some of the things that could be a risk to their privacy. It can be read to them, and then they can agree and document it within the chart, and that was just part of the CARES Act. HIPAA compliance moving forward. I'm sorry, I'm fighting allergies, so please bear with me. What does HIPAA mean right now, and how do we plan for the return of the previous policies and procedures? At some point, the emergency will be over, and what will the ground look like then? So HIPAA states, a covered entity must be able to implement procedures to regularly review records of information system activities, such as audit logs, access reports, and have security incident tracking systems. Under the new COVID-19 public health emergency waivers, providers have been given permission to use the less secure avenues of delivery: Apple FaceTime, Google Duo, Google Hangout, Facebook Messenger, and I think there's a few others on that list. The platforms do the job, and they do help deliver care quickly and implement telemedicine quickly in a pandemic. They do have a level of encryption and are usually utilized on a one-on-one basis, which makes them a little more secure. But as far as HIPAA compliance is concerned, these platforms are considered conduits. In fact, Skype released a statement stating that it is a conduit and that it has no legal responsibility under the HIPAA guidelines. None of these platforms are going to let you know if there is a security breach. They do not offer a business associate agreement, and there isn't any way to track any kind of log or movement within these platforms. Therefore, they are not considered HIPAA compliant. Any physicians using these at this time should be planning to move to something different at the end of the emergency waivers, because it's likely that if HIPAA comes back full swing, these will not qualify under the regular HIPAA guidelines. With that, I just want to mention that you cannot use any public-facing technology for telemedicine, so no TikTok, no Facebook Live. I don't know any physicians that would use it, but just as sure as I don't say that out loud, I will make sure to include that. What is a business associate agreement, and why do I need one, you might ask? Business associate, according to the HHS, is an individual or an entity that performs functions or activities on behalf of a covered entity that requires the business associate to access PHI and is considered a business associate. A business associate agreement will create a bond of liability, outlines the shared responsibility of the covered entity and the business associate BAA, and should include what you can expect the business associate to do to maintain security and reporting practices. Essentially, when this is signed, it is a contract between yourself and the third party that you are using as a avenue, for instance, Zoom. If you're even if you're just using Zoom for your organizational meetings where you might discuss patient information, it is important to have a BAA. That way, if somebody was to hack your Zoom meeting somehow, some way, then they would have a part of that responsibility for the patient's health information not being completely secure. So it is important that you hold the organizations that you're working with partially responsible for that information to ensure the utmost security and encryption for your patients. HIPAA compliant platforms. When you're looking for a platform to utilize, you will notice that the HIPAA compliant platforms usually allow the physician and staff to avoid using personal devices. So if you're trying to use Google or you're trying to use Apple, they usually involve your Apple ID or your phone number. And a lot of healthcare providers prefer that information not be out to all of their patients, and it poses privacy risk when it's on personal devices, because if that device is stolen or broken into, then that information is out there for everyone to see. Another thing to look for is that it provides formal records and a systematic tracking of calls. While I can look on my phone or look on my phone records and see the phone number, I can't see specific information that you would need to track. I know that in compliance, a lot of times they run certain things to check to see if things were accessed or people treated their neighbors, etc. Those formal tracking of calls and public health information are important, and they're required for HIPAA compliance. And usually it includes tools like a compliant texting or messaging. You shouldn't be just texting on your phone with patients. And so that is included in the HIPAA considerations, because that information could get out there. And, obviously if you're texting orders to a patient, that if somebody got your phone, they would know that that is your patient and you gave them those orders, which is actually health information. Platforms to consider are Zoom, which we're on. Zoom has a nice healthcare platform. DoxyMe is another one I've had some experience with. American Well, Teledoc, UpDocs. There are a lot of up and coming HIPAA compliant platforms, but my highest recommendation is you do find a platform that does include a detailed BAA, so that way you are sure of what they're doing to keep your patients and your information safe, and you have a way of tracking that information in case there was ever an audit.
Around 1 o'clock, or as soon as you're done, it depends upon sure. Okay. So you said did you?
And then that brings us to the environmental considerations. And the environmental considerations for HIPAA, you should consider patient location. And when I say that, going back to the good faith effort that they've required for the COVID waivers, patient location is very important. If your patient logs into your telemedicine visit and they seem to be in a crowd of people, you should try to steer them away from that location for a visit. Ask them to go somewhere more private, ask them to reschedule to a time when they can be more private, or if that is not possible, ask them to come into the office for a visit. Even though the patient is opting to be in McDonald's and Starbucks, and maybe they have their headphones in, everybody around them can still hear what they're responding to you. And while that's their information, you as the licensed provider should take that into consideration. And it's one of those good faith effort things that we have to hold ourselves accountable for. So the location of the patient should be vetted to make sure they're in an appropriate location to do a healthcare visit. Even if they said they wanted to, we would not do a patient healthcare visit in the middle of the waiting room. So we should try to encourage them to go someplace more private. Another environmental consideration is the provider location. You as providers, some of you are doing visits from the office, some of you are doing visits from home. It is important that visits are not done from public locations by the provider as well. It's also important that when we're in a home environment that we consider who can hear our visits. So if we are in a closed office, but maybe we don't have good sound barriers in our home office and we have family members that may be in the home, it's important to get some white noise or sound makers for outside the door to disrupt so that nobody could hear the conversation that's going on, so that way they can be assured of privacy. In the clinics, it's important to make sure that the environment is quiet and that we take in consideration of what can be heard or seen by the patient themselves, because HIPAA goes two ways. It's not just the patient you're in the visit with, but we also have to keep all the patient information saved for every other patient that we see within the clinic. Another consideration when we're talking about the environment is who is in the room. You might start out your visit with asking, is there anybody joining you for this visit? Because sometimes our window of view is very narrow, but it's important for us to know who is present for the visit. Is it their son? Do they have 5 people sitting at the dining room table? And ask them that strict consideration. I have a background in home health, and even if I go into a person's home and they seem ready for the visit, I always have to ask them, is it okay if we have this conversation or if we talk in front of this person? It is important to have that consideration when you're zooming into somebody's living room for a telemedicine visit. Although they have people there, just to cover you, it's important to ask who's in the room and is it okay for us to proceed with this visit at this time. Just that way you can document that in your record, and that covers you if there's ever a HIPAA question about that patient in the future. You'll have that piece of information in your chart, and then when it brought back up, they'll say, you noted that her son was in the room and she was agreeable to continue the visit discussing whatever with him in the room, just as if I was to join somebody in the office. Another big consideration for HIPAA and HIPAA compliance with telemedicine, and I probably see this privacy issue more than anything else, which is microphone sensitivity. Absolutely do not leave your telemedicine visit open with the microphone on and leave the room. Even if you're doing visits in a clinic, the microphones pick up so much more than just the average person sitting in a room with a closed door that you are risking breaching the privacy of any patient that you're talking about out in the hallway. And so sometimes our clinical offices get a little loud. You know, maybe we're hollering across because we don't go and talk close to one another, and we're talking about our patient's labs or results, or this patient called. That is all privacy issues that the patient that is now just sitting there on telemedicine has nothing to do but stare at your empty room and listen to every single thing you say about every single patient out in the hallway. So it is very important that whether you're at home or whether you are in a clinic, if you are leaving that session for any reason, that you mute the microphone. Another thing to consider is speakers versus a headset. Speakers work really well. It's easy to hear. As far as infection control, it's the much better option, definitely. But there are downsides when it comes to HIPAA. If the speaker volume is up too loud, people in the hallway can hear the visit. If you're in your home, people in your home can hear the visit if the speakers are up too loud. With a headset, you can only hear the patient, which is nice. And the microphone's a little bit easier for them to hear, especially your elderly. But the headset poses a risk when you're trading computers. So I know that some providers, the nurse goes in, sees the patient on video, does her thing, and then comes out and the provider goes in just like they're rooming a patient. In that instance, a headset would need to be, each person has their own, because there's no way for enough dry time to qualify for your Joint Commission guidelines to keep those clean, although headsets are a good option. So you would each have to have your own headset, plug in and plug out. So depending on where your computer's located, that might be quite the hassle. So just things to consider when we're trying to keep all of our patient information safe. The environmental considerations probably go to the wayside more than your IT regulations most of the time, because people don't tend to realize how the environment can impact who can hear the patient information, and it's not just the patient on the video call. Informed consent. This is a biggie, one that is a work in progress and may change a lot over the course of the next year. So please be alert and looking for any information that comes forth with any of the telemedicine information as the COVID-19 waivers do start dropping off. For COVID-19 waivers, you can just do a verbal informed consent, and you can basically just Google informed consent and find probably 100 different options for telemedicine. Telehealth involves risk to EPHI, which is electronic Phelps Health information. So we have to make sure that the informed consent discusses that somebody could hack into the visit, and it doesn't have to be in those terms, but I would try to make sure that your informed consent is actually something that your patients are going to understand, because if they don't understand what you are telling them, then they are not truly informed. So you'll need to break it down for them and explain that, you know, if something was to happen, that somebody would hack into the visit and see your visit. Not very likely. We have these security things in process, but we have to tell you it's a risk. You know, just like they were going to have surgery, you have to tell them the risk to their information, that somebody might overhear your visit if you have people around you, that You have to make sure they know who's in the room with you, and have their permission. And I would document that in your chart. That's another risk. And then, of course, having a documented consent is the best practice. There are a lot of places that recommend that you send the consent that you're going to have the patient agree to prior to the visit. So if I was to call your office and schedule a visit today for a visit that's Friday for telemedicine, it would be in the best interest of yourself and the patient if you sent that consent through like your My Chart or via mail or via email. And most patients have an email if they're going to do a telemedicine visit, so that they have a chance to review that prior to the discussion in your visit of whether or not they agree to it. It's also important that we are making sure that they understand what a telemedicine visit is when they schedule it, so they're not shocked by getting this form that tells them all the bad things that can happen. Because just like surgery, you know, when you send somebody an informed consent, has all the worst case scenarios and can talk you out of something in a hurry. So that is very important going forward. After COVID-19 waivers, I do believe that informed consent will be required to be signed, and there may even be a time limit prior to the visit that it's signed. I think a lot of our telemedicine platforms have the ability to include that in the pre-visit questionnaires where they can sign off on their side and it automatically goes in the chart. But I think even that portion of telemedicine is so new that they are still working out those kinks. So I think that you'll see a lot of change with that as we move forward.